Hi. Okay, in this video, I'm going to talk about the surgery itself and again, the emotions and feelings that I went through and what you can expect. Um, First of all, I did this alone. I was completely alone. I flew into San Diego, San Diego, and it was the first time I ever flew. And then I waited at a hotel. I stayed in a hotel because I arrived on a Saturday and they couldn't pick me up on Saturday, so they had to get me on Sunday. So I had to stay in a hotel Saturday night, and I was on the liquid diet, so I was extremely tired. I felt lethargic. It was exhausting and very difficult. Um, I took a taxi to the hotel that I was staying in for the night, and I had to wait for them to get the hotel room ready. And when I got there, I just crashed. I crashed. But then later, my body started reacting to just the protein drinks that I was drinking. And with that, I started having a lot of loose bowel movements, and that was really miserable. The next day, I woke up early and went to the airport so I could wait for the shuttle that was going to take me to Tijuana. And they called me and let me know who the driver was going to be, what they were driving, so that way I knew who I was going to be going with and it felt safer. They came in and picked me up, and I went down to the hotel and I stayed a night there, and the next day it was the surgery. Now, when I went in, they did the blood work and then they got me prepped for surgery. Um, when you get the surgery, being that I was alone, I had nobody there for me, so I really didn't know what to expect or what was going to happen. And it was scary. It was very, very scary, but I knew I had to do this for me. So, I started meeting people that were also there. I was not alone at that point. There were, I think, 13 other people, or a total of 13 of us that were doing the surgery. And so you get to talk to them and you get to make friends. And there was one woman, Marcia. She was an angel in disguise. She was there for all of us. She had gotten the surgery 3 weeks or 4 weeks prior to us. And so she knew everything that was happening, and she just pretty much babied the group of us. So it was pretty cool. Lots of people called her Mama Hen, and she was really amazing. But oh, she was there because her husband was getting the surgery. You get taken up to the next floor for your surgery, and then they tell you not to worry. You fall asleep. They use the gas. When you wake up, that's the kicker. You wake up in pain. It hurts. I'm not gonna lie to you. It hurts. It hurts because they have to press air into your abdominal cavity to move the organs out of the way so they can get access to your stomach. And that air has nowhere to go. So you got this bubble of air inside your abdomen, and it's just there, going nowhere. They tell you to walk after the surgery to let it come out, but you don't burp. You can't burp because it's not in your stomach, it's in your cavity. So all you can do is deal with it, and they give you pain medicine. Oh, if they didn't give you the pain medicine, that would be excruciating. You wake up and your mouth feels like cotton. You feel like it's just a big old cotton ball in there. Your tongue is just bouncing around like a cotton ball. You're thirsty. You haven't eaten anything since 10 o'clock the night before. So you haven't eaten or drinking, and you're thirsty. I woke up, and believe it or not, I actually felt hungry. I think it was mental. I don't know. And then you got in your belly, you get 4 to 5 holes in your belly, and they're stitched, and then you have a drainage tube. You're kind of nervous about the drainage tube because you don't want to pull it, and you're walking, and you feel nauseous. They tell you to take the Gas X strips, but to be honest, the Gas X strips do make you nauseous. They really do. Um, I was throwing up dry heaves until finally the after this whole day goes by, finally the night and around the nighttime stuff was actually starting to come up, and believe it or not, it felt better when it finally came up. Um, the first day is literally hell. I remember thinking, had I known it would hurt that bad, I would not have done the surgery. But then I traced back on that thought and I was like, yes, I would. For one day, yes, I would. The next day in the morning when you wake up, that's when they bring you your water and ice chips, and you're scared. You get the ice chips and you get the water and you rinse your mouth to get the dryness out, and then you look at the ice chips and they look so good. But you're kind of scared because you know that your stomach has been empty so long and it's not all there. So I get the ice chip and I chew it and let little drips of water go down the back of my throat, and then it pounds right into your stomach. You get scared and you stop. Then slowly, you start letting yourself let a little bit of stuff into your stomach. They tell you to stay on clear liquids this first day, because the next day they want to do a leak test and check out if you're leaking, make sure there's no leaking. So for that entire day, they took us back to the hotel, which was a medical hotel, had nurses and everything there. I had ice chips, I had water, and I had popsicles. And believe it or not, the pain that I had experienced the day of the surgery was not nowhere near as bad. I think the gas or that air had gotten out completely by day 3. On day 3, when I woke up, they would bring us this bottle of purple booze you have to drink. And that's for them when they do the test to be able to see if there's any leak. And they didn't see any gas in my abdomen. So I think I did pretty good. Then on the 4th day, that's when they take your IVs and everything out. During this process, you keep your IV and all your medication is pushed through an IV. You don't take any medicine by mouth. Then you're able to eat some soup, and it's actually really, really good when you haven't had anything for 3 days. So you eat the soup, you drink the water, you eat popsicles and Jello, and you get so sick of Jello. I don't really care for Jello, but I really don't like Jello. That 4th day, they take everything out and you can go home. So it's an experience, but it's an experience that I wouldn't change. And you do have to clean your belly. Um, when you clean your belly, they want you to wash every day the stitches and the incision area. And I was going to get the soap and I had forgotten, so I definitely will go get that and put it on the next video. But it's an anti-bacterial soap, liquid soap that you put on your stitches, and you clean yourself every day. You're expected to wash your belly first before you wash the rest of yourself, I guess for cross-contamination. And then they dress it, they change the dressings, and they clean it, and they teach you how. So, oh, and they're really, really good with you. I don't know about in the USA what it's like. I have seen videos where they're hooked to pain pumps, but even those pumps will not give you medicine back to back. It has to be in a certain time period. And for them, they give you pain medicine every 7 hours. That's what I was getting. So yeah, that first day, killer. It hurts, but it's worth it. So again, thank you for watching my video. Please like it, and please subscribe, because I will be doing videos along the way about everything. Most of all, make sure that before you decide to do the surgery, any surgery, that you're informed and you have somebody that's walking with you step by step through the way, a medical person. Make the best choice for you. I will talk about my recovery and the process of being at home and making sure I don't lose my hair or my fingernails, and what I learned that was really, really important for your skin, because that is what I'm a little worried about now. Thank you.